Good evening, everyone, and welcome to our program today. In conjunction with Diabetes Day 2021, AMSA UPM has organized today's talk, which is titled Diabetes Mellitus, Exploring the Myths and Facts. Now, before we begin, here are some housekeeping rules for today's program. Participants are reminded to mute themselves during the entire talk. For our participants on YouTube, please adjust your video quality settings for the best viewing experience. At any point during the talk, participants are allowed to type out their questions in the chat box. Participants are also reminded that a QR code will be provided at the end of the program for attendance and merit purposes. Ladies and gentlemen, our talk today is going to be presented by one of UPM's very own senior lecturers, Dr. Ng Ooi Chuan from the Department of Medicine. Dr. Ng obtained his MBBS certification from University Malaya in 1998. In 2006, Dr. Ng was also awarded the MRCP certification for internal medicine from the Royal College of Physicians in the United Kingdom. His work on diabetes mellitus has been featured in several notable publications, including the British Journal of Medicine and Medical Research, as well as the Singapore Medical Journal. So, without further ado, please welcome Dr. Ng Ooi Chuan.
Hi everyone. Yes, Dr. Ng Ooi Chuan here. Thank you, Mr. Kavir Rasan, for the introduction. And it's amazing. It's extremely exciting to see so many young people like you all interested to know more about diabetes, which is, I hope, the things that you learn can be useful to help to care for someone that you know for having diabetes, or even ourselves at some point may get this disease. Without much ado, all right, can y'all see the first slide?
Yes, doctor.
Okay. So special appreciation to Chi Han for helping me to get this feed forward, so that I know who are the one listening this evening. And I think we have an excellent mixture of audiences from various faculty. Okay. So, as a standard approach, I will declare that there's no conflict of interest, that this talk is purely educational. There's no hidden agenda to promote any products commercially. So I welcome all of you, and I hope that together we can transform today, Diabetes Day, to a diabetes-free day. And I hope y'all would enjoy a diabetes-free life. So it's a very important skill because we know diabetic lifestyle, the diet and the exercise program are also suitable to be adopted by healthy people. And we know that many people die from diabetes, which is one of the leading cause of death. And diabetes causes a lot of failure in various vital organs, such as the heart, kidney, brain, eyes, and so on. So the most pertaining myths and facts are, of course, those centered around you, which is the country's future. So let's explore this topic as thoroughly as we can together. So just a definition, diabetes is a chronic disease characterized by high blood glucose. And we know that all carbohydrate food will be broken down and form glucose in our blood. And insulin is a very important hormone that is made by this organ called the pancreas that allow glucose to pass from the bloodstream into the cells to be used as energy. So in diabetes, it's either the pancreas unable to produce insulin or the body fail to respond to it. You can see that insulin acts like a key to open the door for the glucose to move into the cells. Particularly, we are talking about the muscle cells, the fat cells, and so on. So from your, I know that 70% of you think that your risk for developing diabetes is low, and another 30% of you actually have diabetes from the survey that we gather from the Feed Forward, and there are more of you having type 2 than type 1 diabetes. And among the audience, also 25% or 1 in 4 actually by the BMI criteria is overweight or obese for Asian. So diabetes in Malaysia affects almost 1 in 5 adults age 18 and above, which I believe you all would fall into this age group. But 30% is very high, but this is a skewed population because you all have interest in this talk today. So obviously, from a survey also, I realized that half of you either you have it or you know someone close to you have diabetes. And this incidence, the prevalence of diabetes is increasing from 13% up to 18%. That's close to 20%, 1 in 5. And you can see that certain states like in Pahang, in Negeri Sembilan, is even up to almost 1 in 3 adults having diabetes. So besides COVID-19, this viral pandemic, diabetes also in a way can be considered a silent pandemic as well. It's killing 3 times more people last year compared to COVID-19. Diabetes affected almost 500 million people worldwide, and it's moving towards 1 billion people soon. And of course, the middle and the low income countries have the biggest rise, and I'm afraid COVID-19 that smashed the economic in these areas might going to further worsen this. And it's a very costly affair. You can see that Malaysia spends so much until it can enter top 10 in one of the in this projected budget. Can see that we spend so much. Diabetes has cost us so much in terms of the healthcare budget. And it's not only finance to talk about. When talking about diabetes, it's also associated with significant loss of years life. So it depends on what age a person get diabetes. If they get young, they tend to lose more years than they are supposed to live to. Compared to those that get older age group, they only lose probably 1 or 2 years of their expected life. So average for a 15-year-old that get developed diabetes, average losing about 6 years, about 10% of his or her life. So is diabetes preventable? You can see that there's genetic component, but there's as well as environmental. So that when there's an environmental factor there, is something that we can do to prevent it. Compared to something completely genetic, like we're talking about Down syndrome, for example, that's 100% genetic. Right? So yeah, these are ideas from you that how to prevent diabetes. You are correct to point out that should avoid obesity, should take more greens, increase physical activities, and cut down on sugar, calorie restriction, all these things. Your ideas all are correct. Yeah. So let's examine one of the recent years has been described about the twin cycles hypothesis, whereby excess consumption of calorie lead to overtaxing the liver and the pancreas. So these twin organs, they develop fatty changes, and this lead to diabetes. So in this trial called the direct trial, where they put patients on a low-calorie diet, and a quarter of them able to achieve at least 15 kilogram weight loss, and of this, 90% of them became free of diabetes, can off all the diabetes medications. So is diabetes curable? Yeah, I think some of you say yes. So why my pediatric colleagues, what my pediatric colleagues say that if a child has diabetes, all the family members have to adopt diabetic diet and lifestyle, right? But it's not a bad idea to let go of sugary drinks. As you can see, one of the recent publications that consumption of sugary drinks increase risk of cancer. So, which is a very, very frightening thing that, even those 100% fruit juice is also associated with the same risk as well. So, yeah, these are not healthy. Yeah, you might say that the genetic factors is not something we can modify, right? But yes and no. I mean, the genetic code itself, we are unable to modify it. But there are some modifiable factors underneath it, which we call the epigenetic changes. So these changes affect the activation and expression of certain genes by changing the microstructure of the code, not the code itself. So that involves things like methylation, histone modification, that kind of thing. And so yeah, so it is something that we can do about it. So it's not that both my parents having diabetes, sure I'm going to kena. So it's not that totally hopeless. So in a way, actually, although you may not have the chance to choose the set of genes that you want, but you somehow can change the expression and free yourself from diabetes. So what do y'all see here? Right? Yeah, an obese kids probably specky, indoor inclined, sedentary lifestyle probably, and definitely is going to be very high risk of developing diabetes. Sorry, this is a PDF form, so some of it doesn't run. So those fly in, fly out are hidden. Actually, the child story is that what kids should do, actually, they should spend more time outdoors. Outdoors, exposure to the sun, adequate exposures, daily exposures to the sun actually help them to not only getting vitamin D, which I'll show you later that it can help in diabetes prevention, but also it can help the eyeball development so that they would not require spectacles when they grow up. So there's one stone that can hit two or many birds. So vitamin D play a role. You know that sun exposures helps our skin to synthesize vitamin D. It can lower both type 1 and type 2 diabetes. So children with high levels of mirror work and low levels of outdoor activities were almost 3 times more likely to have myopia, require spectacles when compared to children with low mirror work and high outdoors activities. So back to the child, something to think about. Um, so are the kids doing enough outdoor exercise? So children and adolescents aged 6 to 17 years should do at least an hour or more of moderate to vigorous intensity physical activity every day. So do you think our children are doing enough? So this is something that we need to think about. How about ourselves, adults, age 18 and above? Are we doing enough? We need to do at least 150 minutes a week. That's almost half an hour every day for 5 days at least. And also at least 2 days a week, do some muscle strengthening exercise like dumbbell and things like that, calisthenics and so on. So exercise is very important. Exercise stimulate glucose uptake regulation. We know that insulin resistance is the key problem in 9 out of 10 of people with diabetes. And this exercise stimulated glucose uptake by the cells, by the muscle cells, is preserved in insulin resistant muscle because it involves other processes that is different from the way how insulin work. So in these patients, although their body not very sensitive to insulin, that's why they are very prone to diabetes. Their blood sugar tends to go up. But with exercise, actually they can keep their sugar as normal as possible. And exercise able to increase the uptake of glucose up to 50 times through many processes in terms of the delivery, transport, and the intracellular flux through metabolic processes. So yes, so among our students, these are from you. From the survey, 70% not doing enough physical exercise, and 60% actually consuming somehow imbalanced diet, and another 15% probably taking too much of carbohydrate that need to cut down. So while Malaysia got a good high record of wastage in terms of food, but despite that, still very lacking. Our meal tends to lack in the vegetable, tends to be imbalanced, tends to be having very high glycemic index, like what I show Maggie me, without greens, and the kueh, and also lacking in essential vitamins, which are very important because our cells, our tissue need vitamins for optimal metabolism to break down this glucose, protein, and fat in our body. And besides that, eating healthily is very important because you got to think about those bacteria that living in our gut. With different things that we eat, we could be feeding different type of these microbes, and some microbes are good ones, some are bad ones. So the bad one tends to break down the glucose fast and make the blood glucose level go up fast, compared to the good bacteria in the gut that doesn't create such havoc. So those bad bacteria in the gut actually can make a havoc all the way to affect our liver, to damage our liver, and to cause a systemic low-grade inflammation, inflammatory state that is very unhealthy and lead to other damages. So we've got to rethink which food we should choose. I mean, once in a while we can indulge in something bad, but yeah, but not on a regular basis or daily basis. So I believe you all have seen this when you go to the shop that sell cigarette, right? Yeah, but how about this? So how about all these vendor machines that you also see in the schools and all that? Would you like some stickers like those on the cigarette on these machines as well, that you know, cause gangrene of the toes of the you know, in the feet, and cause blindness, kidney failure, or stroke risk on that, right? Together with that also, I take this opportunity to remind everyone that salt intake got to be very, very careful. I know you're still young, but as from the survey, 30% of you already got diabetes. So you be careful. You don't want other combo to come, like high blood pressure, like high cholesterol, and so on. So be very careful to limit your salt intake to not more than 1.5 grams a day. All right. So that's the amount of 1.5 grams, a very minimal a day. For one whole day. So be careful to avoid excessive intake of those very high sodium food, very, very salty food like cheese, canned food, and so on. All right. We are seeing many young adults these days, they develop high blood pressure. That's no joke. And also, we start to see them develop stroke as well. So they tend to develop high blood pressure by age 20 and stroke by 30. So we start to develop, see this kind of patients. So cut down, eat less of those unhealthy things, and cut down your salt, all that. Exercise more, that will help a lot, not only to burn the glucose, but also to sweat out the sodium, the salt. And of course, if you eat less and exercise more, you're going to ease your weight burden, you're going to lose weight, and that is very, very helpful. And if you remember earlier, I mentioned about the twin cycle, the fatty liver and the fatty pancreas thing. Yeah, it helps. Not to forget, stress and sleep management are as important, because also take this opportunity, because diabetes is very much to do also with injury to our blood vessels. It causes an accelerated atherosclerosis, hardening of our blood vessels, so and calcification. So it's something to take care. So to watch this thing about stress and sleep as well, and an extra hour of sleep at night somehow can reduce the risk. But there's a U shape. That means do not overdo. So don't, because I say so, that you sleep excessively. So best probably around 7-8 hours a day. If you want, you can sleep up to 9 hours, but you can see it's not a good idea to sleep for 10 hours every day or more, right? So diabetes is like Malaysians, a very, very diverse disease. Like one of my colleagues actually asked me about his father, recently discharged from the ward, and was changed from oral pills to insulin, and the sugar went very haywire. All right. This is this patient. So I told my colleagues after insulin, I suggested one of the diabetic pills, and I follow through the next few days. The sugar it become more stable and become better, and overall become from uncontrolled become better control. So not all diabetes patient need insulin. All right. On the other hand, there's another colleague that rang me up. He saw a 15-year-old patient, which is very obese, 100 over kilogram, and this patient require up to almost 200 units of insulin, which is true. So together, I guided him to push the insulin to that high. So it's very individualized. That's what I want to say. So management of diabetic patients, very individualized. So some require insulin, some they don't do well with insulin. So we're going to talk about type 1 and type 2 diabetes. Although there are also, I'm not going to talk about diabetes in pregnancy. I omitted that. And I also omitted diabetes due to drugs like steroid, and also diabetes due to other illnesses like injury to the pancreas and alcohol causing alcoholic pancreatitis and so on. I just want to focus on type 1 and type 2 diabetes. These are very distinct disease. So the boy actually he got both type 1 and type 2 diabetes. He got a double diabetes. So type 1 is due to autoimmunity. So there's the body produce antibody that go against the cells in the pancreas that cause destruction, and subsequently the pancreas become fail to make insulin. While in type 2, there's no such processes. In type 2, if you do the antibody testing, they are negative. In type 1, the antibodies can be detected, and it's one of the tests that we have done on the young boy as well. It was positive. It's obese, but he's having type 2, but also type 1 together. So in type 2, what has gone wrong is also a very important component of type 2 is what we call insulin resistant, where there's reduction in the rate of glucose disposal given insulin concentration. So basically the body is not responding very well to insulin. So what worsen insulin resistance is actually overweight, overeating, physical inactivity, the muscle not being worked out. So all this aggravate this state of insulin resistance. So in order to fight insulin resistance, we need to do the opposite. So what are the symptoms to watch for when someone having diabetes? One, they have this excessive thirst that they keep needing to drink water, and secondly, they tend to pass out excessive urine, and thirdly, they always feel hungry. Their body cells feel so stuffed that they keep thinking. A lot of them they even go on to drink all the soda drinks because they really think that their body need glucose. But their blood glucose, the moment the test it, is so high that even the machines, the glucometer cannot detect. It's so high because the glucose, what happened without insulin, and they don't do exercise, it cannot get to the muscles and other cells. And all these symptoms symptoms of diabetes, non-specific tiredness, loss of weight, a very slow wound healing, that kind of thing. But of course, the higher the level of the blood glucose, there'll be more symptoms of those: excessive urine, thirst, and so on. On the other hand, half of them actually rather asymptomatic. They do not experience any particular signs or symptoms. So from our national survey, half of our subjects actually unaware that they have diabetes. So someone can be not having symptoms, but have diabetes. So these are the signs to look for. Check carefully. Not only yourself, check carefully the one that you know, your family members and that kind of thing. Look at the neck. Look at the armpit. Things area, skin folds area. They can have this blackish discoloration, what we call acanthosis nigricans. This is sign of insulin resistance. And I have patients that told me that with exercise, losing weight, all this actually reverse in them. Okay, so in some cases, it could be reversible. And the other picture is diabetic dermopathy on the shins, on the legs, you can see. So those are not very good signs that it already start to show poor wound healing and so on. They can also come with emergency. They can come in very, very dry. They can come in very, very sick and vomiting. They can come in like appendix, having a severe pain in the tummy. They can also come in comatose and die. So these are acute complications of diabetes, what we call DKA or diabetic ketoacidosis. It's a very serious, it's a medical emergency. Patients often need to be treated in ICU to save life. Again, whether it's acute complications of DKA or diabetes itself, the symptoms are not very specific. When they come in breathless, when they come in with abdominal pain, when they come in or vomiting, this kind of symptoms, sometimes if doctors didn't check the blood sugar straight away with a glucometer, they may miss the diagnosis. So DKA tends to occur in type 1 diabetes when there's absolute lacking of insulin and leading to the body breakdown of fat to utilize as energy, and the other products, formations of ketones, which is cause acidosis and lots of other together concerted with other changes during this DKA ultimately can lead to death. So are you going to rush for a screening test? So these are the things that these are the people that need once the age 30 or more should go for screening for diabetes. Those are having symptoms, tiredness, and so on, also should go for a blood test. And also those, like the 25% of you, one in four of you that the BMI of 23 or above, right? Or you can measure your waist circumference, and together, if that is present, together with one more risk factors like physical inactivity. If you are overweight plus sedentary lifestyle, then you should also test for diabetes because your risk is high. Or if you are overweight plus a close relative having diabetes, then you also should go to test for it. So there are certain cut-off point from the blood test to say whether someone is diabetes or not. So in that sense, diabetes is a biochemical diagnosis by the lab cut-off. So this is from you. What's the worst thing if you get diabetes? These are the answer. One of the interesting response is cannot enjoy dessert anymore. All right. Yes and no. I can still chewy, but not yeah, in a very controlled way. So those healthy people are very lucky. It's like a driverless car. Everything is as an analogy. It's just automatic. The blood glucose is just fluctuate within the normal range nicely for you. That we don't have to do anything. But for diabetes, for those with diabetes, it can be a struggle. They tend to have to control the sugar carefully. You can see that it's like driving as an analogy. That having a GPS will be good. That at least can guide us the where are we heading. So a lot of our patients, they need this kind of machines to guide them where their sugar is heading. Is it heading high or going low and all that? Because we don't want it to go high. We also don't want it to go too low. So these are parts of the treatment for people with diabetes, insulin injection and checking of the blood glucose. Of course, newly launched this year, something that now can buy from Lazada, this device can provide continuous glucose monitoring throughout 24 hours. So just a patch with a slight sensor that just go into the skin, but it won't be felt any pain or so. Yeah, with that device, with this device, actually, it helps patients to see how their blood glucose moving throughout the day. So with that, with this device, it can give a lot of analysis. It can help patients to make sure that at least 70% of the time their blood glucose are within the control or normal range. And for type 1 diabetes, it's totally like an analogy is a manual car that they really need to control. Before they take their meal, normally they got to estimate how much carbohydrate are there in that meal inside in the plate that they are going to consume. And from there, they may have to work out and calculate how much insulin to inject before they eat, because it just have to match the amount of insulin that they take for type 1 diabetes need to match with the carbohydrate content in their meal. So it can involve quite a bit of calculation. So that was type 1, but type 2, on the other hand, insulin and other thing is monitoring and all that may not be necessary in a lot of patients because they are somehow luckier in a way that unlike type 1, type 2, their pancreas still produce insulin, and the main problem with type 2 is insulin resistant. So there are medications, there are pills to fight against insulin resistance. And in fact, there are not only one type of pills. There are so many medications, so many types of medications to treat type 2 diabetes. Compared to type 1, the only answer is insulin. Type 2, there are many different category of medicines to treat. And but recent development also found that also described in type 2 diabetes, there are besides the pancreas and the muscles and the liver, there's also issue with other organs, like the kidney tends to reabsorb too much glucose. So there are medications to let the glucose come out from the urine. And also there's the gut that is also tends to absorb too much glucose. So there is also a medication to deal with that. And there's also the brain that is having a poor appetite control, leading to overeating. Also, there are medications to deal with that. So in type 2, in fact, combinations of medications, so it can help better. So the choice of combinations, of course, it depends on individual patients. So some patients they have other complications like kidney or heart and all that may require certain diabetic medications that have added value that can give them protections from this illness, these complications. So diabetes is not just about blood glucose, but it's also to control other things like blood pressure. So about blood pressure not only about salt, but also there are lots of medications, and some are preferred than others for patients with diabetes. And besides glucose, blood pressure, the other thing not to miss, of course, is cholesterol. And so a lot of our diabetic patients also, they require, we prescribe them with statin, which is a cholesterol lowering medication. Especially we prescribe to all when they come to age 40 and above. And when they're younger, with additional risk factors for the heart disease, also it may be reasonable to start them as well on medication. And some of them even require surgery to lose weight. Like those BMI above 40, they can do what we call a sleeve gastrectomy to remove part of the stomach, or to shorten the small intestine to create malabsorption. That kind of metabolic or bariatric surgery can be done. And in the carefully selected patients, the results can be very good, up to 85–90% of them. In fact, they can go into what we call remission, that we can stop those insulin or diabetic pills, and their blood sugar can be normal for some time. So looks like it's reversible with surgery. And we have done a study on our patients, and yeah, a lot of our diabetic patients, they do take traditional medicine or even supplement, which is a very common thing. So a lot of these agents have been studied. Some of the Ayurveda medications, ginger and so on. Some of these may be able to lower the blood glucose a bit. On the other hand, there are others that that have a conflicting effect. And we've done a study on Ulam Raja supplement, and which give some effect as well in lowering blood glucose. So the risk of all the complications, especially those pertaining to the blood vessels problem, vascular complications, those microvascular small vessels involvement leading to damage to the retina, damage to the kidney and the nerves. Those involving big vessels, like those block in the heart, in the brain, stroke, or in the leg, can cause gangrene. The toes can turn black and drop off. And the other issues with diabetes as well, they get diabetic foot, they get erectile dysfunction and other problem. And the other non-vascular, they can get depressions, they can get fatty liver and cirrhosis, they can get a lung dysfunction, breathing problem, and joint problem, increased risk of fractures, and increased diabetic is also increased risk of cancer of the liver, pancreas, and some certain cancers. So this is a study on our patients, our diabetic that attend our diabetic clinic. We found that can see that almost 36% of them already got complications, cardiovascular complications. Another 10% they got stroke, and 5% they got peripheral vascular disease, and 40% of them got nerve problem. Up to almost 20% have a kidney complications. 1 in 6 having retina damage, and diabetic foot ulcer. They got irritating foot ulcer in about 3% of them. So so this is a spectrum of complications, and a lot of time we try our best to help patients to get their blood glucose to control, but it's just many times over times the complications they do come up. So this is the answer from you. Which complication that you think is the worst to get? So quite significant number of you, 30% of you think that the liver is something that you worry about. 1 in 4 worry about kidney. 15% worry about the skin thing, the wound, the leg amputation thing. 10% of you worry about the heart. 10% worry about the eye. 5% worry about the brain. 1% worry about the immune system. I think now is the COVID and the diabetes. Although diabetes doesn't mean that they get COVID more easily, but they tend to get increased death among diabetes with COVID compared to non-diabetic. So complications from diabetes, we can see HbA1c is the average blood glucose level over a period of 3 months before. Normal should be around 4 to 6. So you can see that the moment A1C, this average blood glucose, go up, the risk of complications start to rise, especially start to rise when it above 6.5%. And initially you can see that the complications increase with the increase in the HbA1c, but what you notice also, you can see the curve suddenly the graph suddenly the line suddenly become very steep, and it turns exponential the moment it goes beyond 8.5 or 9%. So initially linear, but subsequently it went very steep and exponential. So these complications are one of the problem is one of the mechanism is through this thing. When there's high blood glucose, it leads to formation of what we call advanced glycation end products. So this advanced glycation end products can lead to various injury to all the vessels, small or big. And these products are formed by non-enzymatic manners. So that's different compared to naturally glucose. When it's metabolized by our body, is controlled by enzyme. But unfortunately, if the blood glucose is too high, it undergone these changes. It forms this product. So this one is not something that we can control if our blood glucose go high, because this one is non-enzymatic bonding. So these products lead to a lot of oxidative stress, free radicals that cause a lot of damage and exacerbate atherosclerosis, hardening of our blood vessels, and so on, block the vessels, and so on. So in the eye, can lead to blindness, and some of the blindness among our patients with diabetes are very sudden because of what we call retina detachment. So the retina just suddenly being pulled and tear off, and suddenly patients just turn blind. So this is one of the mechanism. There's something what we call diabetic retinal retinal syndrome. When changes of the vessels, the damage in the retina, also tends to be same. All these changes in the kidney lead to leakage of protein in the urine, and so on. So the same damage tend to occur. This when the eye doctor sees some damage in their eye, got to think that this patient's kidney also must be in a bad shape. And how about heart? Yeah, so based on the previous Finnish study that described type 2 diabetes patients without coronary heart disease events, they had a similar risk of dying as someone not having diabetic but had a previous heart attack. So that's why traditionally, historically, it described this diabetes as coronary artery disease equivalent or risk equivalent. But at the moment, we just say that they are high risk. That's why we start them on statin. Although all patients with heart attack, we start them on statin. But those diabetic, although they don't have heart attack, but we know that if they're high risk of heart attack, like they're age 40 and above, we'll treat them because of this issue with the heart disease equivalent. So when does this threat began? The heart. So the risk to get heart attack actually years before a person develop overt diabetes, before their fasting blood sugar turn abnormal. There's a period what we call pre-diabetes. So when this person during the period of pre-diabetes, which is about 10 to 15 years before a person develop overt diabetes. So during that period itself, the person already had an increased risk of getting a heart attack. So that's because even during this pre-diabetes period, although the blood sugar is mainly goes very abnormally high, mainly after meal, but somehow there's a lot of changes, particularly pertaining to the bad cholesterol that can clog the blood vessels. So these are the bad cholesterol, LDL. It can get trapped in the intima, in certain layer in our blood vessels. That it got trapped there. It attract it causes inflammations and subsequently atherosclerosis, hardening, and so on. So how about kidney? Yeah, kidney also can be affected, like I mentioned earlier, beside the eye, retinal renal syndrome. So once kidney is affected, there are many changes, like patients will develop high blood pressure and will develop electrolyte abnormalities. They tends to become fluid overload and acidosis. And kidney also help our marrow to make red blood cells. So with kidney complications, also they get anemia. And kidney also help to activate vitamin D, which is a very important step. Without that step, vitamin D is useless. It's not being activated by the kidney, certain of the kidney cells. And that will affect the bone. They'll develop metabolic bone disease as well. And of course, most worrying is leading to dialysis, which can compromise life a lot. But a lot of patients, they do not really end up on dialysis, because you can see here, as their kidney function worsen, the risk of dying from the heart event, when it turns very steep, become exponential, very, very high. So only a small proportion of them actually end up on dialysis because they survive the heart thing. Okay, some of you may be doing intermittent fasting. I've known that some of my patients are doing this intermittent fasting. Yeah, it may work because intermittent fasting may force our body to clear up, to use up whatever available. So hopefully this process is what we call autophagy, eating cell. Hopefully this process, it helps to clear out the advanced glycation end products. Nerve problem, what we call diabetic neuropathy. A lot of them are having that nerve damage without knowing. They are without symptoms. Those that having symptoms varies. Some complaining of pain, burning, tingling, while others complain of numbness, loss of sensation. Besides that, our nervous system is not only peripheral nervous system. Some of the system, what we call autonomic nervous system, also affected. Our sympathetic nervous system and our parasympathetic nervous system. So this is what we call the diabetic autonomic neuropathy. The manifestations are a lot. Include hypoglycemia unawareness, means that if the blood sugar normally goes too low, patient will be aware, but they become unaware when they got this nerve complication. They don't have the tremor, hunger, sweating, and palpitations. They don't have these symptoms of hypo. And it does affect the heart, causing the resting, increase in the resting heart rate. It causing blood pressure to drop when patients get up fast, so they can have a fall, old people. And it causes a lot of patients also complain of gastric problem, indigestions, and stomach upset. A lot of patients also asking for gastric medicine, but some of them are actually don't have gastric problem, but mainly the effect of diabetes on their autonomic nervous system that supply their gut. Of course, diabetes can also lead to infertility in men. All right. And also, there are many reasons. A lot of diabetes patients also, they present with leg swelling, which probably a mixture of this. By the time they develop leg swelling, probably they have some degree of kidney failure, some degree of heart failure, a significant degree of fatty liver. Nerve damage itself also can lead to leg swelling, joint damage, and vein problems, and so on. And this is from you. Half of you think complications from diabetes are reversible. 40% think it's not reversible. 10% doesn't want to think. All right. So there are results that published many years ago that shows that histologically they're able to demonstrate reversibility of these changes. So it shows that early diabetic changes does improve when with a good glycemic control. And even kidney. So even all the histology, the cell damage that they can see under the microscope, somehow when the blood glucose is normalized through this transplant surgery, after a long period of normal blood sugar, like 10 years, the changes actually, the scars, all that disappear. So normal cells take place. So somehow it does give hope about reversibility. So exposure to high glucose level also lead to DNA changes, affect the DNA repair, and all this cause instability of the gene and increased cancer risk. And this is one of our publication in the Selangor Medical, in the Singapore Medical Journal, that having diabetes with heart complications also compromise their quality of life. So take-home message. Knowledge is power. So with today's knowledge, I hope what you all learned today, I hope that you all can empower a healthier society. Hopefully start from your family, and we know that with health it comes a better happiness and finance prospects. And I want to say that diabetes free is a choice that you make and a health skill that you develop from young. And if the fittest and healthiest in the world are pumping up their muscles every day, why don't you? And there's this paradox of life: less is more. Less choices sometimes give more happiness. And the paradox of food consumption, I would say calorie restriction is for life extension. Once people heard from this, when I let go of what I am, I become what I might be. But I say, when you let go of the fat in your body, you might become diabetes free. top one, of course, when the time comes, when you need regular biochemical testing or lab testing of your blood glucose, please do so. With that, thank you for your attention.
Wow, that was quite an interesting talk.
Yeah,
Now,
so it's question time.
yes, doctor. So now we proceed with the question and answer session. Participants are reminded to not leave the talk as merit will be provided at the end of the session. Okay, doctor, our first question is from Benjamin Liu. Hi, doctor. I heard that diabetic ketoacidosis is one of the complications when patients with diabetes are unable to get the insulin shots on time or if they miss their shots. Is this case common in the ward?
Yes, very common. We have patients coming with diabetes, these complications on the regular basis. Yes, very, very common. Especially because they are type 1 and they tend to be in a very, very challenging age. A lot of this are in the adolescence, early adolescence, 13, 14 years old. They are very, very rebellious. They are in denial, very strong denial. They just wouldn't accept this thing called diabetes, and they wouldn't accept the insulin injection. So when you leave the treatment to them without supervising them closely, these teenagers, they won't do the shot. Yeah.
Okay, doctor. Our next question is from Muaz Malay. Is there any sign to know that they have diabetes?
Yeah, so watch out those symptoms. But if I say that, that is not reliable at all because those symptoms are not specific. Because those symptoms are what we experience, all of us experience sometime in our life. They're so non-specific and nothing really that particular pointing towards diabetes. And worse still, half of them actually do not have symptoms. So 50% are asymptomatic. So it's totally unreliable. So just watch out your waistline. If you are a man, your waist circumference more than 90 centimeter, you can convert to inch, your pants size. And for women, ladies, 80 centimeter, if you exceed that, or your BMI, you can go by your BMI, 23 and above. Plus, if you are not active, sedentary, and other risk factor, family history, and all that, you just have to go ahead and test your blood glucose, especially test after meal, not only fasting. Fasting may be normal. So during what we call the pre-diabetes state, which is good to detect because this pre-diabetes, this window period occur up to a decade before a person become frank diabetes. So this period is very good to test after meal. After meal, the blood glucose will be abnormal, although their fasting can be normal. And this is the time that if you do in lifestyle changes, you can prevent developing overt diabetes.
Okay, Priyanka Veer Singham is asking, can underweight people have diabetes type 2?
Yeah, because theoretically yes, but practically we don't see as such, right? Practically most type 2, like I've done the study of our diabetes, those patients attending our diabetes clinic, almost near 100% of them actually overweight. Yes, we found some 5% of them actually normal weight. Underweight we didn't find. Theoretically it can be yes, but practically we don't see. And if we see, we got to suspect some other problem, because why they are thin, we test antibody negative, so they are not type 1. But we got to suspect another type, what we call monogenic diabetes or MODY. This monogenic diabetes is due to single gene defect. It's autosomal dominant. Usually very strong family. Half of the family members will get it. Half of the siblings will get it. Offsprings will get it. And yeah, so because of certain gene that affect this particular persons, so they can be they can be not fat actually. Yeah, might be underweight there.
Okay. Anglin asks, good evening, doctor. May I ask, is bariatric surgery dangerous? Would someone have eating disorder after bariatric surgery?
Yeah. The bariatric surgery is about weighing the benefit and risk, right? So to do or not to do, because if you are not doing, so some of our patients are super obese. Their body weight, like the other guy, was 9 months bedridden because his body weight almost 300 kilo. So this medical assistant in one of the is a medical assistant in one of the hospital in North Malaysia. So he suffered like that. You can see that he undergone bariatric surgery and his weight come down below 150, right? He lost that. And he's able to walk again, no more bed bound. So you can see where was he heading. If he doesn't have the bariatric surgery, if he continued to bed bound, you can see where is he heading. So it's about weighing the risk and benefit. And how risky is bariatric surgery? It's just like removing the gallstone, which I can tell you that I before joining the physician training, I was the medical officer in the surgical department. All patients that admit for gallstone surgery, you never think that they will die. They're definitely going to walk back home. We see all of them walk back home. So it's not something you see it so high risk. It's like removing gallbladder. I'm sure you ask around neighbors, a number of them had removed their gallbladder. It's a common surgery, and we hardly hear a patient die from it, unless in the very, very bad surgeon hand that we must not refer any case to that surgeon.
Okay, doctor. Reena Raj is asking, good day, doctor. Is diluted sugary drink better for the diabetic patient as it contains less sugar?
Which one? Sorry, the question is sugarless, right?
Diluted sugar drinks are better for diabetic patients.
Diluted. Yeah, I know some patients they do that. So they pour the can, then they add more water, but it doesn't help, right? Because it's the amount of sugars that get into the body, right? Whether dilute or concentrated, it's the total amount of glucose that count. Same thing, right? Some other patients they ask about brown rice or white rice or whatever rice, but all this carbohydrate is still converted to glucose. So it's the total amount that matter as well. Yeah.
I agree, doctor. Arif Najmi asks, good evening, doctor. My name is Arif and I'm a first-year medic student. I want to ask, why some people with diabetes mellitus lose weight faster than others?
Okay. In type 1 diabetes, is the body produce antibody that attack the cells in the pancreas to drop in their insulin production. So this thing varies because some of them they only got one antibodies, some got 3 or even more types of antibodies, and some of the antibodies, in some of them the antibodies level is very, very high in the titer. Some are lower. So although all that's why I say diabetes is like Malaysians, it's very, very diverse. So some can just the onset very fast, just within a few days, but some they come in with a longer history of 2 weeks or 2 to 4 weeks, longer history of symptoms. Yeah.
Okay, our next question is from Dr. Ng Ooi. Can diabetic patient donate blood regardless its type? Is there any caution after taking insulin?
Yeah, I'm afraid that means that they donate blood. Yeah, I'm afraid that the medical team may not accept their blood because those taking medications and injections, I know that many times they got rejected. Yeah, they do not, the medic team do not receive their blood because they are worried about all these chemical compound remain active in their blood. It might affect the recipients later. Yeah.
Okay, doctor. Our next question is from Lim Wen Hui. Good evening, doctor. There's always rumors stated that consuming too much sugar will cause diabetes. Is that true?
Yeah, in a way, because sugar is very energy dense, so I believe it comes along with weight gain as well. Yeah, so excessive consumption of calorie, it does affect, as I showed you in the twin cycle thing. It overwhelms the liver. You subtract too much of calorie, and every half a gram increase of fat in the pancreas itself increase the risk of diabetes, right?
Okay. Krisha Patil asks, good evening, doctor. Just curious, when is alternative site testing or AST for diabetes patient is not recommended? Thank you, doctor.
Sorry, what is that?
When is alternative site testing AST for diabetes patient not recommended?
Alternative site testing, what is that?
I also do not know, doctor.
Yeah.
Okay, I think we'll just skip that question. We move on to the next question from Saida Shafia. Good evening, doctor. I'm Saida. I'm a second-year medic student. Are the complication of diabetes mellitus most serious in elderly or youngster?
Of course, age doesn't really matter as such. But of course, in elderly, we tend to see them with a lot of complications because they have comes a long way. The duration of diabetes are longer, so that is related more because of the duration of diabetes. On the other hand, young people, we are worried because then they got more years to go against the durations. So it's the duration. When it comes to talking about complications, very much to do. It goes with the cumulative glycemic burden in a lifetime. So that cumulative glycemic burden is very much to do with duration. The longer you live, and it also very much to do with the level of sugar, how high over that long period.
Thank you, doctor. Puravin Raj asks, greetings, doctor. Why is it sometimes the diabetes associated with ocular complication? How does that happen?
Ocular complications? Eye, is it?
Yeah, eye.
Yeah, like explained earlier in the slides that there are many processes that happen. One of it is through these formations of the at once glycations end products, and that cause damage to the vessels and then the retina.
Okay, thank you, doctor. Lu Chengi also asked, I'm so sorry, doctor. My book asks, is stevia good to use in diet to substitute sugar intake?
Sorry, what diet?
Is stevia. Stevia is...
Okay. Yeah. That is commonly used artificial sweeteners and all that. yeah, there are many types, stevia, and then some others. Yeah, well, good in the sense that this doesn't really affect cause the blood glucose level to go up. But on the other hand, a lot of artificial sweetener got to be very careful because there are many in the markets now. And more important is you got to consider the lifetime cumulative dose. So a lot of all this chemical, how much actually our body can allow them to accumulate. So that is something that yeah, got to be watched for, because we may not have the answer now. If you taken in the control recommended small amount, I think it should be harmless. Yeah.
I see. Thank you, doctor. Nur Shafika asks, good day, doctor. Are patients on insulin have more serious diabetes than those on oral medication?
Yeah, it's not really as such. I mean, it could be as such, yes. But because if yes, it's because yeah, those that is so bad, unable to control with pills, we switch to insulin, yes. But on the other hand, no, it's because it depends on the type of diabetes. As I say, type 1, the answer is insulin, while type 2, insulin is last. So one insulin is the first, the other one insulin is the last, yeah.
Okay. Next question is from Alvin Yee. Good evening, doctor. Is the treatment for MODY same as type 2 diabetes mellitus, or OHA is more effective than insulin for them?
Yeah, MODY, or the monogenic diabetes that I mentioned briefly just now. So MODY also, there are many types. There are more than a dozen of them. So depends different type of MODY. Some type of MODY, like MODY type 2, normally doesn't need any medications, although their fasting sugar is abnormal. They don't have long-term complications, except during pregnancy, they may need some treatment during pregnancy. And MODY type 3, yeah, it's worthwhile trying. Like recently, I saw a patient in my clinic 2 weeks ago. I suspect the patient's this lady had a MODY type 3 probably. I actually wanted to let her try switch for insulin to yes, certain oral pills, what we call sulfonylurea. They tends to have a very sustained response, durable response by giving a low dose. Theoretically, yes, but at the end I didn't switch, didn't do the switching, because actually she's just married. She want to start a family. Her sugar is very nice on insulin. So yeah.
Okay, thank you, doctor. Our next question again, Krisha Patel asks, I'm sorry for the confusion, doctor, but from what I knew is that AST, or alternative site testing, means using a part of the body other than the fingertips to obtain blood for blood sugar testing. So her question is the use of AST recommended for diabetes patient, or is it not recommended?
Yeah, okay. I mean, yeah, other sites also mainly depends. If you just prick, extracting blood from the capillary. So that we are testing for the capillary blood. But if you draw from the veins, then it's a venous blood. So the thing is, there's a slight different discrepancy in the blood glucose in the capillary and in the veins as well. So that they have the different cutoff. So it is still okay if you but you must know you're extracting from the capillary or the venous blood glucose. But you have to use different cutoff, right?
I see. Thank you, doctor. Chang Yongbing asks, how to maintain optimal glycemic control?
Yeah, that's why I put out the analogy about driving, because yeah, it will be like driving. How you going to drive to let's say, how you going to drive to Kota Baru from Kuala Lumpur without hitting on the road divider or drive into the ditch, right? So yeah, it's very hard without watching the road. So you need some form of GPS to guide. Is the best thing to reach the destination safely, smoothly. So yeah, so a very good way to achieve it actually is now is this diabetes technology. What I one of the slides I flashed is continuous glucose monitoring over 24 hours period, which can order from Lazada, can buy straight, and use. And yeah, by watching that your blood sugar every 5 minutes as you like, or every minute as you like. So you can really ensure that your blood sugar doesn't go high or low, right?
Thank you, doctor. So moving on, Nur Nabila asks, good evening, doctor. May I ask, is brown sugar effective as a substitute for white sugar to prevent diabetes?
Yeah, that's the same thing like the rice thing, brown or white rice. Yeah, whether brown or white sugar is the same. Ultimately, it's just the quantity of glucose that you are getting into the body that counts.
Okay, thank you, doctor. Once again, another question from Cheng Yong Bing. Oh, sorry, sir. Next question from my mug. Is consuming bitter things like bitter gourd effective to lower down the blood sugar level?
Probably because, as I shown earlier in one of the slides, that there are various testing on various type of plant, traditional products and all that, Ayurveda and all that. It does have a lowering effect. Although most of them are very short study over 3 months period, but they are able to demonstrate fall in HbA1c of more 0.5% or more, which considered significant. Yeah. And a lot of patients, they can provide us their testimony that yeah, after they take all this, their blood sugar come down. They always say that yeah, some of the things may work. In fact, metformin, one of the medications that we use to treat diabetes, also is come from plant extract chemical. Yeah.
Okay, thank you everyone. But I think that is all the time that we have for the Q&A session today. On behalf of AMSA UPM, I would like to once again thank Dr. Ng Ooi Chuan for taking the time to give this talk. As a token of our appreciation, we would now like to present an e-certificate to Dr. Ng.
Okay, thank you very much.
Thank you, Doctor. Now, I would like to request all the participants to please switch on their cameras for the group photo session.
1, 2, 3, smile. Again, one more time, please. 1, 2, 3, smile. Thank you.
Thank you, Dr. Ng. On behalf of AMSA UPM, I would like to thank everyone for attending today's talk and making this program a success. But Diabetes Day 2021 still isn't over. AMSA UPM has also organized a game session quiz for tomorrow on the 27th of January 2021. The quiz will be via Google Forms and will be open from 8 p.m. to 8:30 p.m. This quiz is open to both UPM students as well as the public. So we hope that everyone can participate tomorrow and make the program a success. Now, students may scan the QR code shown to register their attendance for today's program. Alternatively, they may also click on the link provided in the chat box.
We are the music makers.
The Google form will only be open for 5 minutes and merits will only be provided to students who register their attendance. Thank you and good night, everyone.
Okay, good night, everyone.